Addressing the regional health officers at the Ministry of Health's boardroom at Brigham, Georgetown, Subject Minister Dr. Frank Anthony reminded them that Guyana has agreed to meet international targets and eliminate malaria, HIV, and leprosy.
And each one of you at the regional level, you have a unique opportunity to transform what health looks like in that region.
He explained that through an evaluation of the country's healthcare system conducted by the Pan American Health Organization, PAHO, 216 interventions are required. Now the ministry intends to broaden its efforts and support across the country to meet primary healthcare targets. Over the next 3 days, the RHOs will discuss the country's national health response to many ailments. Dr. Anthony reminded that the ministry is focused on controlling HIV by 2030. He said some $100 million will be allocated to each region to cater for infrastructure and training. He also told the RHOs that with the transformation of the healthcare system, there is no reason for some regions to have access to programs and medications while others are without.
Last year, one of our strategies was to give people bed nets. So we give them insecticide impregnated bed nets. These are long lasting. So if somebody sleep under the net, because mosquitoes feed at certain time, and if you're under the nets during that period, it actually is very protective. And if mosquitoes come and land on the bed net, then they will die because they're coming in contact with an insecticide that would kill them. So we want to encourage more use of the bed nets.
Other areas that will be discussed during the 3-day conference include ensuring that healthcare is implemented within the school system, therefore ensuring that children are incorporating healthcare early in their life. Already a manual that incorporates the necessary protocols of the country's primary healthcare system for professionals to follow. There is also a health screening program being implemented as of July to ensure that eye care and other issues are diagnosed early. Dr. Anthony said that the ministry also wants to encourage both male and female children to get their HPV vaccination.
When we look at our cervical cancer rates, for example, cervical cancer among women is the second most prominent cancer or more prevalent cancer that we have. Breast cancer being the number one and cervical being number two.
According to Dr. Anthony, the telemedicine program will be expanded to cover 19 facilities by this month's end. The response for treating diabetes, mental illnesses, and mental health provisions will also be discussed as interventions will soon be implemented. Reporting for the newsroom, Lazini Yearwood.